Welcome to Pop Health Week, streaming live on Healthcare Now Radio. I'm Greg Masters, co-creator and executive producer. Joining me in the virtual studio is my partner and co-creator, Fred Goldstein, lead host of the program and president of Accountable Health, LLC. Pop Health Week is your trusted source for bold conversations with the leaders shaping population health, from health systems and payers to policy innovators, technologists, and the frontline thinkers tackling the biggest challenges in healthcare. To connect with us, schedule a guest, or explore sponsor packages, visit popupstudio.productions, contact Fred direct at www.accountablehealthllc.com, or follow him on LinkedIn. Fred, thanks for anchoring this, what I'm calling special MAHA, Making America Healthy Again, edition of Pop Health Week. With all the surrounding turmoil, not just specific to health policy, there is turmoil in our country. We need to have a frank conversation about what's happening at HHS, CMS, CDC, NIH, and FDA, literally across the public health infrastructure, at least at the federal level. I'll be direct and associate myself with these comments, not necessarily you, but from my point of view, Secretary Kennedy is unfit to serve in his role, and his hand-picked agency leaders represent collectively a threat to not only U.S., but global public health. So that's where I stand. Let me be clear on MAHA as an objective: making America healthy again by addressing chronic disease, obesity, food quality, additives, lifestyle factors, etc. That's both notable and necessary, because SAD, as we know it, the standard American diet, is not a public health enabler. So a prevention or health versus sickness orientation is beneficial from a public health or population health specific perspective, and sorely needed. The connection between chronic disease and what we eat, how we move, our environment, collectively the social determinants of health, these are legitimate public health priorities. But Fred, the anti-vaccine ideology being imposed from the top down, the systematic dismantling of surveillance programs, think USAID, the replacement of scientific expertise with political loyalty, this isn't health policy. It's ideology masquerading as reform. And the consequences are already here. So let's break them down somewhat systematically. First up, the January 5th vaccine schedule massacre. Tell us a little bit about this, Fred.
Yeah, just unbelievable. And just a great introduction, by the way, Greg. I think the points you pointed out, MAHA is a good idea. But some of the ways and the things that they're doing and implementing this just do not make sense when you begin to look at the U.S. healthcare system and how we as a country live and need to improve our health. So, as you pointed out, on January 5th, 2026, HHS drops this bombshell. They go ahead and completely overhaul the childhood vaccine schedule. They essentially shrunk it from 17 to about 11. And, as is just amazing, they pointed out this model they compared it to, oh, we're going to do like Denmark does. Well, that's not really an apples to apples comparison. Denmark has roughly 6 million people in their entire population. Their population is fairly singular in individuals and how they look at it. They do measure things differently. They don't look at race. They look at where you came from, and that's how they sort of have people. But 85% or so are were considered Denmark or born in Denmark. And so when you look at that, they also have this incredible healthcare system where it's everybody's in. You're there, you're in the healthcare system, you're covered. You have access. 90 plus some high 90% of people have a doctor there. And we have a completely different system of healthcare, but we also have a completely much more diverse population. We're obviously, you know, what is that? 6 million to 350 million. It's a huge difference. And all of those things are things that we would typically look at, and why each country typically looks at their country. And then they don't necessarily say, well, I'm comparing it to them and I'm going to do what they do. No, they look at their different factors, what their healthcare system is, what their hospitalization capabilities are, their funding, etc. And so this was just kind of bonkers and from out of the blue. Um, they demoted some vaccines, and interestingly, the American Academy of Pediatrics is suing the government over the changes back in the summer to the COVID vaccines. And so it's sort of, as somebody pointed out at a quote, and I don't know where I got this from, it's a civil war in the medical community. The American Academy of Pediatrics is saying we're going to keep going with this schedule, although you have changed it.
I believe just recently there was an announcement, an alliance announcement between the American Academy of Pediatrics, AMA, and a few other major medical specialty societies who came out just that, pretty much saying that they're sticking with the original schedule, not buying these top-down revisions. And in the middle of that, Denmark's a great situation. I mean, a homogeneous, if you will, genetically culture and default opt-in nationalized health insurance cradle to grave, a little bit different there. Plus, they're very outdoorsy, very active. Their diet is nothing like the sad American diet. So, but also related to this massacre is what happened with the advisory committee for immunization practices. Tell us about that. What happened there? There's been a major change there.
Yeah, essentially, the Secretary Kennedy came in and just knocked them all off the committee. And this was the group that would typically get together, pull the data together, experts in immunizations and public health, things like that, and say, here's what we're going to do. But they would do this publicly. They would have hearings. They would bring the data together. They would release stuff to the public. They would vote publicly. And in this case, none of this happened. It just was done. The committee was out, new committee appointed, and they went ahead, and then this just gets released.
Right.
So when you look at that, it's just another case of where we're supposed to see some transparency, which would make us all feel more comfortable about healthcare decisions we're making because we can see, well, it's based on these data elements or those. That
Mm-hmm.
doesn't exist.
Yeah, and oftentimes this quote deep state idea and how all innovation, all meaningful innovation doesn't have a chance because of this resistance is futile stuff around the deep state. If there's any emphasis in the federal government, especially how they essentially make rules, they invite public comment. That notice of proposed rulemaking is a long, extended, iterative process that engages the public, special interest, the whole thing, and it mashes up. And because of that diversity, it takes time to get things through. So it is slow, without a doubt. But here's the top-down piece, and the one bit of information I find very interesting is HHS, the acting CDC director, Jim O'Neill, is a Silicon Valley investor with no medical degree or clinical experience. And he's the one who signed off on the recommendations from officials who are longtime critics of the existing vaccine schedule. And this is the quote from HHS after an exhaustive review of the evidence. We are aligning the U.S. childhood vaccine schedule with international consensus while strengthening transparency and informed consent. What's your reaction to this, Fred, calling
So
this
that's a
an
great one.
exhaustive
First,
review?
I love the exhaustive review because, as numerous experts have pointed out, there hasn't been any change in the data that was used to make the original decisions. So there's nothing new that came out that they suddenly said, oh, wow, we got to change this because of XYZ. And if there was, you think they would have released it and said, hey, we have these other data that shows that these are reasons why we're making these decisions. But to say that we're matching up to other countries, and in specifically Denmark, which is the lowest of all of them at 11, the majority of European countries are at 14 or 15 minimum. And so that's just not true. Why we would pick the low balls when we have a completely different healthcare system and different situation versus, say, France or Germany or these others that may be at 15 or so vaccines just doesn't make any sense. And this idea that there was an exhaustive review, well, if that's the case, let's put it out in the public domain, see what they looked at, see who made what decisions and why, and then say, oh, yeah, I can trust that decision. But no, there's none of that out there.
There's none of that out there. And this wholesale firing, 17 members, all of them was previously serving in good faith at ACIP. What is the PAL rule? If you break it, you own it. Well, he broke it, he owns it.
Right, right, absolutely. And to say, I think what was it originally when he went through the hearings, we're not going to touch ACIP. I'm going to leave that up there. And I mean, it's like, what is going on? You
Well,
testified to this, and then you go ahead and do something completely different.
well, he's saying the motivation was conflict of interest. He felt there were people there who were basically conflicted. And but what the data actually shows, and this is research from USC Schaefer Center, found that reported conflicts on ASIP had been at historic lows for years before Kennedy's dismissal.
Wow.
Furthermore, the type of conflict typically considered the most concerning, income from vaccine makers, had been virtually eliminated among members of the CDC panel. So the pretext may not be there anyway. He did what we did. Okay, so we're running out of time. Let's accelerate the process here and talk about what's next on our agenda. Medicaid reporting gutted, making America blind again. Let's talk about that.
Yeah, so this idea that we're making decisions in the public, and sort of gets all back to that, is what are these decisions based on? What do we know? Well, they told Medicaid stop reporting on the vaccine rates of children. So, but they did say you need to report on the fact that the physicians talked to the individual about getting vaccinated, but we have no idea if they did it or not, which means we're flying in the dark. We're flying blind in a lot of ways, and we're seeing that across the board with what's going on up there. But it really is fascinating that we change these long serving reports and gathering of data that allow us to make good decisions based on the most recent information we have and science. And we're just seeing that disappear.
Why don't you elaborate a little more on that about these websites going down and, in essence, what might be called the data blackout from CDC? Talk a little bit more about that.
Yeah, so what we it says, it's sort of like what you don't know can hurt you. These databases are disappearing, and this study that was just recently done and published, or this article pointed out that nearly half of the CDC's active databases have been paused or archived since mid 2025. So we're now flying blind. And these are things that people would routinely look at. I know that when we were doing some COVID work back in the day, we were looking at the databases showing the information of what was happening week to week or in different parts of the country, et cetera. And so doing this just kind of creates this whole situation of, well, what really is happening? And if anything, for those who are sort of more into this or in the healthcare sector, these are important pieces of information to have to be able to plan in your community for the public health departments or the hospitals to understand we just had this versus hearing it third hand through somebody who says, hey, I think down the street we just had a dang infection, you know. And so I think it's really important to recognize that this is just one more example of a short-sighted decision that's going to make a major impact on the country and our health.
Yeah, and unfortunately, it's not limited to CDC databases. In January of 2025, we had what I'll call the Friday night data massacre. On Friday, January 31st, 2025, several federal government data sets went offline, including widely used large scale national health surveys, indices, and data dashboards that inform research, policymaking, and media coverage about healthcare and public health. By Sunday, some of the landing pages started to come back online with a warning message. CDC's website is being modified to comply with the President Trump's executive orders. Fred, this is 1984 stuff. We're not changing policy. We're erasing the evidence that would otherwise allow us to evaluate those policies.
Yeah, absolutely. Absolutely. See no evil.
Yeah,
You know,
I know.
yeah, if it's not out there. And the majority of those databases that were taken down or that don't have entries had to do with vaccines.
Yeah, so
And
I'll put
so,
in a plug for our Internet Archive. If you're not participating with Internet Archive, which scrapes the internet and saves things for posterity, please do. I do. Hope you do as well.
yeah, and I know a number of, not a number, I remember reading that some organizations or some universities had pulled the databases down and were trying to recreate them and keep them going themselves. And I think that's extremely important and helpful.
Just tuning in, you're right on time for Pop Health Week on Healthcare Now Radio. Today we're joined by Fred Goldstein, president at Accountable Health LLC, in addition to his role as host and co-creator of PopHealth Week for a special edition of MAHA, the Making America Healthy Again initiative of HHS Secretary Robert F. Kennedy Jr., and the public health impact of what many see as less than science-based policies at critical federal public health infrastructure. Stay tuned. We are just getting started. Okay, moving on, because we're running out of time. There's a lot to cover. I mean, measles is in the news, unfortunately. So let's talk about this South Carolina measles catastrophe. The consequences are in real time, as we're seeing. Tell us about that.
Yeah, so we now have an outbreak in South Carolina that surpassed the outbreak we had in Texas, which I believe was somewhere around 760 cases. And this one is now at 789. I think in the last week they reported close to 90 new cases. And so, as you talk about, is this the canary in the coal mine? Is this what we're going to start seeing from here on out because of this? And when you look at the data from that, 695 of those reported were unvaccinated. 14 were partially vaccinated with one of the recommended two doses, and 20 were fully vaccinated, and 60 were unknown. And when you think about this, they're saying, oh, there are these negative consequences for vaccines and stuff. But the rate of negative consequences is so low. There's a risk with everything we do. There's a risk going out and driving your car. But we take that risk because we believe the risk is worth more, the reward of driving, et cetera, is worth more than the risk. And we have the same thing with vaccines. In most cases, the risks from vaccines are very, very low. And the numbers of what actually comes out at the end is very low. Yes, there are some risks, but the potential and the savings, and particularly in the United States, and we talk about the risk of death, and that's definitely a problem, but low. But it's also hospitalizations. We see a lot more of these people, these kids hospitalized because of getting these diseases by not having the vaccine. And so I hate to say this, but you sometimes think, might the hospitals like that? We got more
Right.
admissions. But if you,
Right.
but if you don't have room, et
Yeah.
cetera, think back to the early COVID days, holy moly. So the key is to recognize that this change in these vaccinations is impacting these communities, and now we're seeing it. We used to be a country where we could say measles was eradicated. And maybe this year we're going to not be able to say that anymore because of the outbreaks we're now having. And these are kids being impacted, and not everyone's going to come out of this from that sickness being okay.
Yeah. And the rationalization here for an indefensible outcome with uh, this top-down ruling on vaccinations is
The-
uh, uh, Ralph Abraham, MD, who's the principal deputy director of the CDC, said that the United States losing its measles elimination status is the cost of doing business. I mean, I say, what? We gained elimination status in 2000. 26 years of public health progress is about to be erased. Last year, the CDC confirmed 2,255 cases nationwide, the most since 1991. The agency has also confirmed 3 deaths last year involving 2 children. So we're going backwards.
And the other thing that was interesting is, we have this VAERS, Vaccine Adverse Event Reporting System. And typically, the way that works is anybody can call in and say anything, which is the way you do it. You just grab it all, even if it wasn't associated with actually the vaccine. So somebody gets a shot and they feel sick the next day or their foot hurts, they can report, hey, my foot hurts. It may not have been due with the vaccine, but they typically took one report, per thing. But now, if the individual calls in and the doctor calls in, they're counting them both on the same case. And so you're going to get this secondary reports issue. And is that just going to create more noise? Because when you finally look at these numbers, the actual incidents typically are very low for really vaccine related types of issues.
Yeah. And this kind of brings us to maybe the most tender point for me, and that is this idea of individual choice versus public health. It's a quote false binary, if you will. I mean, let's address the underlying ideology directly. We keep hearing from some about individual choice, medical freedom, informed consent. These all sound reasonable on the surface, but this is a false choice. Talk to us about how individual choice and public health aren't opposites, they're actually interdependent.
Absolutely. So I'll take a different example. When I drive a car, I don't have a choice to wear a seatbelt. I have to, or I'll get a ticket, and that's because the risk of me not wearing that is higher, and the government has said we're going to say this is important enough that you need to do it. And now what they're saying with these various vaccines that previously the data showed was important enough we should be doing this because it may be you not getting infected, but it may keep a whole bunch of other people also from not getting a disease is now, in certain cases, an individual choice. And I think that's, going backwards. And that's why, but we do have this big anti-vax movement in the United States. And now we have, individuals in these states who are coming down with diseases that we didn't have before. And hopefully what I hope happens is that we don't see then people start moving even further upstream and saying, I'm just not going to get that vaccine for my child. Particularly if the state doesn't require it or things like that to go to school and things, which some of the states are now moving towards. And so suddenly we're going to see a resurgence of polio. See polio come to the United States? Who knows? And so I think those are some of the reasons why it is a false narrative to say, this needs to be always individual choice, or in these cases individual choice, because there are plenty of other things where we just don't have a choice because the government has said that's important to do.
Right. And there was a bifurcation here. I mean, it really is a false equivalent. It's not a binary choice either or, it's both and.
Hmm.
However, the way this was framed, the context it was put in was, you know, the existing model, healthcare delivery model, the financing and delivery model is predominantly fee for service. There's some inroads made by value-based healthcare and some modest capitation case rates and stuff like that. But for the most part, it's still driven by a production-based incentives. So the pushback has been, public health and population health to a degree as well, looks at, population level stuff, community level stuff. And the pushback was, well, you're not going to tell me I have to wear a mask. You're not going to tell me my kid can't go to school. You who are you to say
Right.
any of this? But you in this context are the public health officials that we pay to protect us from threats, some known, some unknown. And we saw how that pushback was generated by, some might say, the overreach of some of these non-pharmaceutical interventions, masks and physical distance separation, stuff like that, and a vaccine schedule. It all worked from a public health perspective, but those who ideologically oppose, Big Brother saying anything about health choices, health related choices, it's anathema to them. And they grip on the false narrative that, oh, medical freedom, choice, empower the sovereign citizen, and somehow the community will ultimately benefit because we'll make smart choices. No, it doesn't work that way. So
Yeah.
it sounds like it sounds like it's a health related prescription when it is in fact an ideological imposition of another person's view.
Hmm. Yeah, and I think, sadly, if you trace this back to the original COVID situation, they did not do a good job. The government,
Yeah,
originally it was, oh, wipe your
yeah,
surfaces, it's all
yeah,
contact.
yeah,
Baloney. We had
yeah.
seen the study from China
So,
that showed in a restaurant that this baby was aerosolized, and you could see it
mhm,
from the way the air flowed and the
mhm,
people sitting at various tables. And
yeah,
that was in February or March. And then come
yeah,
out, well, wear a mask. You wear a little cloth thing that you crocheted up, and so some mistakes were made, and then you lose trust. And sadly, the medical and public health profession have lost trust. And getting that back is always difficult. Putting that genie back in the bottle is going to be tough. But we do know that there clearly were things that made a difference back in the day. Wearing a mask actually made a difference.
Absolutely.
Getting yourself tested,
Yeah.
going ahead and
Yeah.
taking a vaccine made a difference.
Yeah, I'm reminded of that movie with Dustin Hoffman, like Pandemic or something, and he's got a sign that says, "It's airborne,"
Oh yeah, oh
as he's
yeah,
fully geared. So
right.
let's wrap this because we are out of time. I said at the top that MAHA, making America healthy again, is a noble objective. The chronic disease crisis is real. The food system is broken. The lifestyle factors driving diabetes, heart disease, obesity, these are all legitimate public health priorities that deserve serious attention. But you don't address chronic disease by creating acute infectious disease outbreaks. You don't rebuild trust in public health by firing every credible expert and replacing them with ideologues. You don't strengthen transparency by shutting down databases. You don't protect children by eliminating the vaccines that have saved millions of lives. So, Fred, having said all that, what is there a pathway forward?
Well, I think the best pathway forward at this time is for individuals, and I say this all the time, get yourself a really good physician who you can trust and work with them and make, because the key physician associations are saying we're going to stick with our schedule of vaccines. This is important. And I've seen that no matter what area of healthcare, if you can find a physician that really understands it, you're going to be in much better shape. And so that's what I would tell people. Get themselves a really good physician. Be sure if you're pregnant or having children, you're talking to a really good pediatrician. And you can see what the pediatric, the Association, American Academy of Pediatrics says. Follow the guidelines.
That's awesome, Fred. I want to be clear about one thing. The people implementing these policies, Kennedy, his appointees, they genuinely believe that protecting Americans from corrupt systems and harmful vaccines. But I believe they're catastrophically wrong. I think they believe what they're saying.
Thanks so much for a great discussion, Greg. This is important stuff, and I hope people have listened through and follow up and read the real science.
And thank you for your participation as well, Fred. To our audience, the science is clear, the data is clear, the history is clear. Vaccines work. They've eliminated smallpox, nearly eliminated polio, saved millions of lives. The current leadership at HHS and other federal agencies writ large represent an existential threat to that legacy. We'll continue to track this on PopHealth Week. That's a wrap for today's episode. A big thank you to our global audience for tuning in, and extra special hat tip to Fred for his time today. If PopHealth Week brings value to your work, please support the show. Give us a thumbs up on your favorite podcast platform. Share the episode with your colleagues and do subscribe so you never miss a conversation. Remember, PopHealth Week streams live on Healthcare Now Radio every weekday at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. That's 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. On behalf of Fred Goldstein, myself, Greg Masters, and the entire crew at Healthcare Now Radio, thanks for listening. Stay well, stay engaged, and we'll catch you next time on PopHealth Week.